Illinois is reviewing new guidance from the Trump administration that open the door for states to impose work requirements on Medicaid recipients, but there is no indication yet that it will follow the list of neighboring states that are pursuing plans to tighten their rules. Governor Office and the State Department of Healthcare and Family Services said the new policy and its implications are under review, but the Republican administration has not signaled whether it supports Medicaid work requirements. Local patient advocates said they hope Illinois does not join the 10 states that already have submitted proposals to make having as of a condition of Medicaid eligibility, for fear it would leave tens of thousands of people without health insurance. Meanwhile, Wisconsin and Indiana welcome a letter issued Thursday by the Federal Center for Medicare and Medicaid Services announcing that the agency will support state efforts to take incentives that make participation in work or other community engagement a requirement for continued Medicaid eligibility. They are among the states awaiting word from CMS on their request to impose work requirement, effort that were routinely rejected under the Obama administration when state brought them before. Kentucky is expected to be the first state to get permission, but Indiana also expects its waiver request to be approved in the coming day, whether it is as of training, volunteering, substance abuse treatment, additional education or another opportunity. Becoming an active and productive member of the community is an important part of healthy living. Dr. Jennifer Woodhull, Secretary of the Indiana Family and Social Services Administration, said in a statement, "We'll work closely with eligible healthy Indiana plan member to find the best option that will, over time, help lead them to self-sufficiency and stability, as well as employ a sponsor of private market health coverage." According to Indiana's proposal, able-bodied people could receive Medicaid only if they work at least 20 hours per week over 8 months, or enroll in time or part-time education, or participated in the state job search or training services. Its existing initiative to connect Medicaid recipients with employment services is voluntary and not enough people participate, the state proposal said. Wisconsin is evaluating how the new policy will affect its proposal, which is meant to help more people move from government dependent to independent by encouraging work and providing incentive for healthy lifestyle, said Elizabeth Goodrich, spokeswoman for the Wisconsin Department of Health Services. Wisconsin proposal, which apply to able-bodied adults without children, seek to limit a person's eligibility for Medicaid to 48 months unless they can show they have been working at least 80 hours a month. Other requested changes include requiring Medicaid recipients to undergo drug screening and seek treatment if they test positive. States can tailor Medicaid eligibility through by seeking waiver from the federal government, a process that does not require approval from the state legislature. In its guidance issued Thursday, CMS said it would support state requests to require the Medicaid beneficiary to work or engage in skill training, education, job search, caregiving or volunteer service. The rule can apply to people who are disabled. CMS said the shift is anchored in principle that emphasize work to promote health and well-being, but critics of work requirements say they contradict the core purpose of Medicaid, which is to help low-income people access medical benefits, and could end up making it even harder for people to land jobs if they end up being sicker. Work requirements are cruel and outdated, and CMS is encouraging them on the notion that low-income adults don't work unless forced to do so, said Kathy Waligora, director of the Health Reform Initiative at Everett, Illinois. More than 1.2 million non-disabled working adults receive Medicaid in Illinois, and most job work. 2/3 of Illinois non-disabled and non-elderly Medicaid recipients who are more part-time jobs, and more than 80% are part of working family, according to the Kaiser Family Foundation analysis of 2016. 6. Census data. Many other caregiver or go to school, though participating in such activity would theoretically ensure their continued Medicaid benefit or legal or that failure to comply with on rules administrative requirement could cause even those who are eligible to lose coverage, and despite exception for people with disability, she said there are many people who don't meet legal definition of disability but have medical condition that present barrier to employment. People would have to be put through tremendous hoops to prove they are disabled, said Stephanie Orman, Director of Healthcare Justice at the Sagan River National Center on Poverty Law. In addition, calling on people to work doesn't address the various barriers that keep many low-income people from doing so, including low educational attainment, homelessness, criminal record, lack of access to transportation, and undiagnosed mental illness, domestic and or violence, high regional unemployment rate, and stagnant wages. According to the River Center, work requirements also are opposed by the Illinois Health and Hospital Association, which advocates for more than 200 hospitals and nearly 50 health systems in the state. The group believes work requirements would limit access to care and leave hospital picking up the tab for uninsured patients. Our main concern is that people have coverage so that they have the care they need, said Danny Chun, spokesman for the association. We hope that the state would not pursue TSIS. Major shift open way for Medicaid work requirement.